Separation anxiety can be one of the most emotionally taxing behavior concerns to address, and that's because it impacts your entire life. But there are a lot of things we can do to support our dog in being more comfortable home alone. Unfortunately, there is a lot of bad advice out there, including just crate your dog in a stronger crate. And then it seems helpful because the dog can't break out and destroy furniture anymore. They can't jump out of a third-story window. They can't have accidents all over the house or chew up the baseboards. But unfortunately, crating the dog in a stronger crate has done nothing to make them feel safer home alone. So like this commenter is sharing, they're just panicking and now they can't get out of a crate. Dogs with separation anxiety often comorbidly have confinement anxiety. Clinical separation anxiety is a medical condition diagnosed by a veterinarian. Dogs with separation anxiety generally need the support of daily behavior medication, as well as behavior therapy. And I strongly recommend that behavior therapy come from a certified separation anxiety trainer when separation anxiety is the primary concern. Many of my clients do have some form of separation-related distress, and sometimes we work with a certified separation anxiety trainer in tandem, or sometimes it's a situation where separation anxiety or separation-related behaviors are one concern amongst many, and reducing their stress holistically and the other things we do in behavior therapy gets that to a place where the dog feels comfortable being home alone. In any case, the first step is management. We want to avoid absences, and this is the hardest thing. We want to get really creative. Can the dog go somewhere else? Can someone come stay with the dog? This is one of those things that seems impossible at first, but often we are able to come up with solutions so that the dog is not left alone until they have that capacity. When that's not possible, we absolutely want to be using event medication prescribed by the veterinarian to help reduce that stress response so that hopefully we can get the dog from that full panic to stressed but not as stressed, or even in some situations, not stressed at all, which is fantastic. Again, this is usually in combination with a daily maintenance medication. Separation anxiety is often comorbid with physical health issues. For example, we recently talked about a study on here where even mild subclinical GI symptoms were associated with increased negative emotional states and specifically behaviorally separation anxiety. So like we always do in behavior work, we also want to take a close look at how the dog feels physically in their body. For more information, you might follow some of the excellent certified separation anxiety trainers here on TikTok. I'll tag a couple in the video.